Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University. I hope that everyone is safe and healthy. Today on Diamond Doc, we're going to talk about ulnar collateral ligament injuries of the elbow and specifically differences in treatment options for younger and older players. First, let's review the anatomy and function of the elbow and the ulnar collateral ligament, or UCL. The elbow is the last major joint in the kinetic chain of throwing. Every pitcher knows that throwing the ball with velocity starts with the large muscles of the lower extremity and core. This results in a succession of joint forces that transfers the energy to successively smaller joints and muscle groups before ball release. You can think of this similarly to how a whip tapers to a small tip but picks up speed along the way. This results in the potentially dangerous scenario where the smaller joints, like the elbow, see the maximal forces. One thing that is required in order to stay healthy is that proper technique must be maintained in order to not overload this joint. When the forces that reach the elbow exceed the strength of the UCL, injury occurs. In younger players, the ligament tends to tear directly off the bone, either at the humerus or the ulna. The ligament itself tends to be intact. It is the attachment that is disrupted. Recent advances in surgical techniques now allow for repair of this ligament in these situations rather than reconstruction or Tommy John surgery. The surgeon will typically use an anchor to reattach the torn ligament back to bone. This type of surgery results in significantly less downtime and rehabilitation time than a full Tommy John surgery. Most players are able to return to competition after 6 months. In older players, the injury that occurs in the UCL tends to be in the middle of the ligament. This is most commonly the case in college and professional players. When the ligament itself is injured, a reconstruction must be performed in order to restore stability to the elbow. This is the Tommy John procedure. The surgeon will use a tendon from another part of the body or a donated one to weave into the bone of the humerus and ulna in order to make a new ligament. The recovery from this procedure is long, and players will typically miss a full year for rehabilitation. The decision between repair and reconstruction is determined by the location of the injury. As we discussed, this commonly correlates with the age of the player. Either way, the rehabilitation requires significant time and effort. Injury prevention, specifically elbow UCL injury prevention, should be a focus of all throwers. For the young athletes, adherence to the Pitch Smart guidelines with pitch limits, 3 to 4 months off per year, avoidance of playing with pain, and limiting play to one team at a time can all minimize the risk of injury. And arm care needs to be a part of every thrower's routine, regardless of age. Do you have other questions or comments about the treatment of UCL tears in throwers? Please respond in the comments and ask your questions using the hashtag USABmailbag.